Have you ever looked in the mirror and noticed your hairline slowly creeping back? Or maybe your crown area thinning just a little more than usual? You're not alone. Hair loss affects millions of people worldwide, regardless of age or gender. But what if I told you there's a solution that doesn't require surgery, expensive salon treatments, or weird gimmicks? A solution that's been trusted for decades and backed by science? That solution is Minoxidil. But what exactly is Minoxidil? And how does it work to regrow hair? Is it truly effective for everyone? Or are there some limitations? Can you really rely on it to restore not just your hair, but also your confidence? And what should you expect when you start using it? Results, side effects, and long-term impact? Stick around as we dive deep into the powerful benefits of Minoxidil, explore how it transforms lives, and discuss whether it might be the right solution for you or someone you love. Before we get into the good stuff, make sure to hit that subscribe button, turn on notifications, and give this video a thumbs up if you're ready to take control of your hair health. Share this with anyone struggling with hair loss, they'll thank you for it. Now, let's get started. Minoxidil first entered the medical world as a treatment for high blood pressure. That's right, before it became the go-to product for hair growth. Doctors prescribed it in pill form to help lower blood pressure. But something interesting happened. Patients began reporting unexpected hair growth as a side effect. This unexpected outcome led researchers to explore its potential in treating hair loss. And eventually, topical Minoxidil was born. Today, Minoxidil is one of the most widely recommended over-the-counter treatments for androgenetic alopecia, more commonly known as male or female pattern baldness. It's available in both liquid and foam forms, and it's often sold under brand names like Rogaine. But what makes Minoxidil so effective? The secret lies in its ability to stimulate hair follicles and increase blood flow to the scalp. Hair follicles can shrink over time due to hormonal changes, genetic predispositions, or aging. When they shrink, the hair they produce becomes thinner, shorter, and eventually stops growing altogether. Minoxidil helps reverse this miniaturization process. It enlarges the hair follicles, allowing them to produce thicker and longer hair strands. Think of it as giving your scalp a second chance at life. What's even more interesting is how Minoxidil extends the anagen phase of hair growth. The hair growth cycle has 3 phases: anagen, growth; catagen, transition; and telogen, resting. When more hairs are in the anagen phase, you get fuller, healthier-looking hair. Minoxidil helps push more hair into this active growth phase and keeps it there longer. So, how soon can you expect to see results? That's a question many users ask. The answer depends on your individual biology, how consistently you apply it, and how long you've been experiencing hair loss. Most users begin to see noticeable results within 3 to 6 months of daily use. But patience is key. Minoxidil isn't an overnight miracle. You have to be consistent and committed. Now, let's talk about who can benefit from Minoxidil. While it was initially marketed primarily to men, Minoxidil is also effective for women dealing with thinning hair or whitening part lines. In fact, the FDA has approved a 2% solution for women, though many dermatologists also prescribe the 5% foam depending on the individual case. Women with postpartum hair loss, hormonal imbalances, or hereditary thinning can see great improvements with consistent use. Minoxidil is also being explored for other conditions like alopecia areata, where the immune system attacks the hair follicles, causing sudden and unpredictable hair loss. While the results here are mixed and depend heavily on the severity of the condition, some patients have reported regrowth after using Minoxidil in combination with other therapies. Now, let's address the elephant in the room: side effects. Is Minoxidil safe? Generally, yes. Most users tolerate it very well. However, some may experience mild side effects such as scalp dryness, itching, or redness, especially when they first start using it. These side effects usually go away as your scalp adjusts to the product. Imagine waking up, running your fingers through your hair, and not worrying about what you'll see in the mirror. Picture going out without a hat or scarf to hide your thinning hair. That's the kind of change Minoxidil can bring. And it's not just wishful thinking, it's supported by thousands of clinical studies and real-life success stories. Let's also take a look at how Minoxidil fits into a complete hair care routine. It works best when combined with a healthy lifestyle, adequate sleep, balanced nutrition, stress management, and gentle hair care practices. Supplements like biotin, zinc, and vitamin D can complement Minoxidil's effects, and using a DHT-blocking shampoo may also help enhance results, especially in those with hormonal hair loss. Now, let's say you're ready to try Minoxidil. Where should you start? First, determine if your hair loss fits the profile. Gradual thinning or pattern baldness are ideal cases. Then choose the right strength and formula. The 5% foam is usually the most recommended, especially for men, while the 2% solution might be better for sensitive skin or first-time users. Apply it consistently, usually twice a day for men and once a day for women on a clean, dry scalp. As you begin your minoxidil journey, take pictures each month to track your progress. Hair regrowth is often slow and subtle, and looking back at photos can help you see the improvements you might not notice in the mirror every day. And if you found this video helpful, don't forget to like, subscribe, and share it with friends or family who might be struggling with hair loss. We've got more science-backed health content coming your way, so hit that notification bell to stay updated.